There are many ways to contract viral hepatitis, but most commonly, and the most common viral liver disease that we see today, chronic hepatitis B, is contracted at birth or in early childhood. And when people contract it at these very young ages or perinatally, quite often they will go on to develop chronic infection and have it over the course of their lifetime. Hepatitis B, of course, can also be contracted in adulthood or in young adulthood. And in these cases, it can be contracted sexually. It can be contracted by exchange of drug paraphernalia. It can be contracted in any kind of blood-borne virus mechanism, that the same way that you contract both hepatitis C and HIV. So we have to be very conscious of the fact that there are multiple ways that people could contract hepatitis B. Different type of hepatitis, hepatitis A, hepatitis E, these tend to be contracted by the fecal oral route, which is different to hepatitis B, C, and Delta virus. But, you know, understanding that there are multiple ways that you could contract viral hepatitis is very important for both the doctor and the patient. Chronic hepatitis B is a serious condition because when you have this chronic virus, you tend to have it for your lifetime. And it's very important that it's diagnosed at an appropriate time point, that the disease is properly stratified, that people understand whether you need treatment, whether you're outside treatment criteria. And when you have those pieces of information, you're in a place where you're able to decide better. Does this patient need to be seen regularly? Does this patient need to take antiviral therapy? Or does this patient not require antiviral therapy, but the disease will require a degree of monitoring and supervision? And we're very familiar with this, and we're very familiar with offering these different courses of supervision or monitoring of the disease, and where necessary, prescribing antiviral therapy to ensure that it's tolerated, that patients take it, and they have a good outcome, and that their disease is not leading to the more negative sequelae of a chronic infection. Viral liver disease is interesting because at the very early stages, you may have virtually no signs or no symptoms at all. So this is why it's really important for patients to consider these diagnoses at the outset. It's equally important for the treating physicians to consider these as potential diagnoses, because if we don't test for them quite often, we won't identify them. So it's not uncommon for viral liver disease, certainly in the early stages, to be asymptomatic. But if we're looking for it and we diagnose viral liver disease, be that hepatitis B, hepatitis C, we will want to offer appropriate treatment if that's indicated. If we diagnose the viral liver disease, we will also want to, if treatment is not indicated, have a clear treatment pathway for that individual so they know what we're trying to achieve and know what we're doing in terms of the management of their disease. So this is the way we would approach the diagnosis and management of viral liver disease. Unfortunately, in some cases, people will present very late, and this is where you get symptoms. So in the case of chronic hepatitis B or chronic hepatitis C, if you go on to develop cirrhosis, you may present with jaundice, so yellowing of the eyes, yellowing of the skin. You may develop ascites, distension of the abdomen. You may develop bleeding. And these are all very, very worrying symptoms that we would look for and the patient should be aware about when they're thinking of chronic viral liver disease. Well, this is a very good question because all viral hepatitis does not require treatment. So for example, both hepatitis A and hepatitis E, as I referred to earlier, these are self-limited viruses most commonly, but they can lead to significant morbidity also, and even mortality in some cases. But generally, these viruses get better themselves. The more chronic viral liver disease, hepatitis B, hepatitis C, and Delta virus, these conditions do not tend to resolve spontaneously, or if they do, it's very rare. So it's in these viral liver diseases that we do need to consider very carefully, does the patient need treatment? What is the timing of treatment, duration of treatment, depending on whether you're looking at one viral liver disease against the other. But there will be some cases still, and specifically in hepatitis B, where patients may not need treatment because their own immune response is controlling or containing the virus. And that's a very important point to make to patients, but we can't get to that decision about whether a patient needs treatment or doesn't need treatment until the patient has been appropriately investigated and appropriately assessed from a medical level. Well, there are different viral liver diseases. So in the case of hepatitis C, there are direct-acting antiviral drugs, which are very successful and can lead to successful treatment outcomes in greater than 95% of cases. So hepatitis C now is a treatable condition, and we expect people to have very good treatment outcomes as a consequence of that. On the other spectrum, we've got delta hepatitis, which is very difficult to treat. And in fact, we don't have treatments in place which can really deliver successful treatment outcomes or cure. So delta hepatitis is at the other extreme because it's very, very difficult to manage at this time point. In the middle is hepatitis B. Chronic hepatitis B, there is treatment which is widely available. These are antiviral drugs, so they are oral tablets in the vast majority of cases, but they do not lead to a cure of the disease. What they do is they suppress the virus, so you have no replicating virus. And by doing this, we're able to turn off a lot of the damage, which often is seen in the liver from chronic hepatitis. So we've got the extremes of treatment, which we would prescribe for a short duration, leading to a successful treatment outcome, hepatitis C. We've got treatments that we can take continuously, antiviral therapy in hepatitis B, to suppress the virus and by and large lead to very good outcomes. And we've got delta hepatitis, which is a very difficult to treat hepatitis, where we're still at a very early stage of treatments that we're using, and it remains to be seen how successful those treatments can be and what they will deliver in terms of treatment outcomes over the longer term.